The World Health Organization has commended and praised South Africa for acting swiftly and for following scientific advice to delay the spread of the virus. Yet, while a nationwide lockdown is probably the most effective means to contain the spread of the virus, it cannot be sustained indefinitely. Our people need to eat, they need to earn a living, companies need to be able to produce and to trade, they need to generate revenue and keep their employees in employment. We have accordingly decided that beyond Thursday, the 30th of April, we should begin a gradual and phased recovery of economic activity. We will implement what we call a risk-adjusted strategy through which we take a deliberate and cautious approach to the easing of current lockdown restrictions. We have decided on this approach because there is still much that is unknown about the rate and the manner of the spread of the virus within our own population. The action we take now must therefore be measured and incremental. This approach is guided by the advice from scientists who have advised that an abrupt and uncontrolled lifting of restrictions could cause a massive resurgence in infections. We cannot take action today that we will deeply regret tomorrow. We must avoid a rushed reopening that could risk a spread which would need to be followed by another hard lockdown, as has happened in other countries. We have to balance the need to resume economic activity with the imperative to contain the virus and save lives. To achieve this, we have developed an approach that determines the measures we should have in place based on the direction of the pandemic in our country. As part of this approach, there will be 5 coronavirus levels. The first level is what we call level 5, which means that drastic measures are required to contain the spread of the virus to save lives. Level 4 means that some activity can be allowed to resume subject to extreme precautions required to limit community transmission and outbreaks. Level 3 involves the easing of some restrictions, including on work and social activities, to address high risk of transmission. Level 2 involves the further easing of restrictions, but the maintenance of physical distancing and restrictions on some leisure and social activities to prevent a resurgence of the virus. Level 1 means that most normal activity can resume, with precautions and health guidelines followed at all times. To ensure that our response to the pandemic can be as precise and targeted as possible, there will be a national level and separate levels for each province, district, and metro in the country. We are currently at level 5, which requires a full national lockdown to contain the spread of the virus. This is the highest level of lockdown and was imposed when drastic action was necessary to curb transmission. The National Coronavirus Command Council will determine the level based on an assessment of the infection rate and the capacity of our health system to provide care for those who need it. We have undertaken a detailed exercise to classify the different parts of the economy according to the risk of transmission in that sector, the expected impact of the lockdown, the economic contribution of the sector, and the effect on livelihoods. Our ministers will provide a detailed briefing on the classification of industries and how each is affected at each level. We will give all industry bodies an opportunity to consider these details and, should they wish, to make submissions before new regulations are gazetted, they are free to do so.